Hi everyone, my name is Jessica and I'm the nurse coordinator at STL Fertility. In this video, I will be showing you how to prepare and administer Menopur. Menopur is one of the medications that will help stimulate your follicles to then eventually get those eggs out at your retrieval. The first step in any injection is to ensure you have proper hand hygiene. To do this, you will want to use soap and water and then dry efficiently. At that point, you can then gather your supplies for your injection. You will now gather your supplies for your Menopur. You will need an alcohol prep pad. You will have a 3 ml syringe or sometimes a 1 ml syringe, a needle for your injection, a vial of normal saline, your vial of Menopur, a Q-cap, and a sharps container. The first thing you want to do when you prepare your Menopur with a Q-cap is take your normal saline vial or water and remove the cap on top of the vial. You will then take your Q-cap device, and here is a sharper object that you will then place on top of the normal saline vial and push down. You can then remove the plastic from the Q-cap device. Here is where your syringe will enter. So you'll take your 3 ml syringe, or could be 1 ml syringe, and you will twist on as such. From there, you will then invert the vial upside down and withdraw 1 ml of normal saline. From here, you will then remove the saline and take your Menopur vial and remove the cap and inject the normal saline after pushing the Q-cap in slowly. Once the water is in, make sure the medication is fully diluted. You can do this by swirling gently, but never shake, as that can make air bubbles. Once you see the powder is fully dissolved and diluted, you will invert again to withdraw the ml back into your syringe. At this time, you can then twist off your Q-cap and set aside. You will then take your injection needle and attach to the top of your syringe. At this time, you will want to make sure there are no air bubbles present. By doing this, you can flick the syringe to get any air bubbles out. You will then take the cap off of your needle and ever so slightly push up so you see an air bubble at the top of your needle. We are now ready to administer your Menopur subcutaneously. To do a subcutaneous injection, you will go 2 finger widths from your belly button to the left or right, and you want to stay at the level of or a little below. It is important to alternate sites after every injection just to give one side a break. The first step is to take your alcohol pad and clean your site in a circular motion. You will then take your medication, removing the safety cap. You will then pinch your skin and at a 90-degree angle, inject the needle fully in. Release your pinch and slowly push the medication in. Once the medication is in, you can then release the needle out. I will tell you, Menopur can have a tingle or burning sensation once injected. Do not be alarmed, that is normal. Once your medication is administered, you will then take your syringe and needle and place this in your sharps container. Your physician may decide to do your Menopur intramuscularly. I am now going to show you how to do an intramuscular injection with your Menopur. For an intramuscular injection, you will need a 25 gauge 1-inch needle. The first step is to determine your site. To determine your intramuscular site, we will be doing this in the deltoid muscle. You will find the shoulder bone and go 3 finger widths below the shoulder bone. kind of where you would get a flu shot or a vaccine. You will then take your alcohol prep pad and clean the site in a circular motion. At this time, you will spread the skin taut, take the needle at a 90-degree angle and inject fully in, release, and push the medication into the muscle. Leave there for a second or two and remove your needle. At this time, you can then dispose your needle and syringe in your sharps container. Thank you so much for watching this video. As always, if you have any questions or hesitations during medication administration, please ensure you reach out to your nurse coordinator.